Good evening, everyone. My name's Safia, and I'm one of the fellows at NHS England. This evening, we're launching the improvement of flexibility within dental training. And this webinar is an opportunity for you all to understand some of the options that have been available for dentists in training and some of the new pilots that are on the horizon. We're moving towards a more flexible approach of working within dentistry, and we really invite you to listen, utilize our resources and hear from an educator and a trainee's perspective. So the agenda for tonight will start off with an introduction. This is to give you an insight into the work that has been carried out by NHS England and what brought us to this point. We're also going to hear from Helen Sanders and looking at flexibility from a trainee perspective. Then we'll move on to Richard Balmer, who will talk about some of the merits and challenges of flexibility from an educator's perspective. And then we have an opportunity for questions at the end as well. So the background. Now, the NHS is committed to increasing flexibility for postgraduate dental training. And the rationale behind that is that from feedback and from workshops, we understand that flexible working is required for trainees for a better work-life balance. It's also a really key element of personal development. And well-being and reducing burnout is something else that was stated by trainees. It's also a key theme that's been referenced in both the NHS long-term workforce plan and also the NHS people plan. Now, when the Advancing Dental Care Report was published in 2021, we can tell from that feedback demonstrated that there is a changing societal trend and that a lot of trainees now will appreciate flexible opportunities as they progress in their careers. So to give you an overview of the work that we were doing in NHS England, I've highlighted a timeline of the steps that we've taken to arrive at this point today. So we started off with scoping. We wanted to understand some of the existing models for flexible training that existed within dentistry and medicine. We then moved on to stakeholder mapping. Obviously, it's really important that all of those that will be impacted by these flexible options are involved in this process. So we also had a plan to make sure that we were engaging with those who would be impacted. We then moved on to a strategy workshop and we carried out surveys. And this was really important because we needed to understand the barriers and challenges from both the educator and a trainee perspective. We then looked to develop those flexible training initiatives and we set out with our objective setting. We also then devised regional pilots and the national ones. And then we move on to communications and engagement. This was a key element that was highlighted by trainees in the sense that they wanted to have a centralized resource where they could access information about flexibility. We decided we would host this webinar to launch the resources. There was an element of audiovisual, and this has been demonstrated from the use of videos on the resource webpage and making sure that we communicate with our trainees and educators through the relevant networks, so NHS England emails. And then we move on to resource development. So through all this work, we arrived at a point where we have a report, we have the web page that's dedicated to dental training, we have the animated videos, FAQ section online, and this webinar for further information. So just to go a little bit more into detail, with the scoping, we looked at the current initiatives available, and these are available in the Dental Gold Guide. And you can have a look at this in your own time, but it just gives us an idea of what was available for trainees when we started this project. And then with the stakeholder mapping, these are some of the stakeholders that were present in conversations, in workshops, in surveys to fully understand how we could improve flexibility for all involved. And then we had a strategy workshop and surveys. So the key thing to highlight from this is that trainees that responded mentioned that they wanted opportunities to undertake flexible training in two main ways. So the first was varied training, so being able to develop those non-clinical skills and capabilities. The second was the ability to train less than full time. When we looked at educators and we had conversations with them, there was actually not many negative impacts that were reported, but what we found is that when there was a negative impact, it was around timetabling and rotations. Now, further information about this workshop and survey can be found in our summary report on our dental webpage. In terms of developing and improving flexible training initiatives, the conclusion that we came to is we would propose some pilot initiatives. So the first one is flexible portfolio training, and that takes into account the ability and the opportunity to develop non-clinical capabilities. So this gives the clinician one protected day per week to engage in a project that will benefit their professional development. This might be healthcare education, this may be research, it may be clinical leadership. We also developed the standalone less than full-time training. So this is the opportunity to take a post on a less than full-time basis. And we hope that this will also widen access to postgraduate training and address inequalities within the current recruitment system. In terms of communication and engagement, it was really important that, as I mentioned before, that we engage with trainees and educators so that it was a co-collaborative approach towards the project. It was also important that we raised awareness of existing flexible opportunities, and we're hoping to address this through the webpage that will have a link to all the resources connected to this work. We also want to promote trainee uptake of these existing options and the proposed regional pilots. In terms of information sharing, we highlighted that trainees wanted preferred channels for this, so webinars, centralised web page, videos, and also the NHS England newsletter and emails. And with any project within NHS England, it's really important that we're able to evaluate the impact it's had and improve that through continuous communication and engagement. So we want to be doing that through feedback. In terms of the resources that we developed, as I mentioned earlier, we have the summary report that's available online to download and read. We have this webinar today, which will also be uploaded online for those that weren't able to make it today to access in their own time. We sent out an email to launch the flexibility initiatives. We also have all the webpage resources available, and this is live now. So in terms of wider impact and consideration, this work fits into work that supports wider organisational objectives. So I've listed a couple of these here. Now, the NHS Long-Term Workforce Plan was published very recently, and there's a renewed focus on retention, but that's through improving flexible options. So some of the points mentioned in that are highlighted here, but the main take-home message is that the feedback from doctors and dentists was that there's a desire for opportunities in leadership, mentoring, and education to help diversify their career, and we're hoping that the flexible portfolio training initiative will help address that. There was also a desire to build on the out of programme pause pilot so that taking out of programme opportunities is more acceptable when we're looking at training pathways. And there's also the need for greater autonomy around flexibility. So when we're looking at career planning, for this to be available a lot earlier on in careers. So we're hoping that these resources will help that. Now, when we look at the Advancing Dental Care report, there was a focus on improving research activity across postgraduate dentistry. So, for example, the out of programme or the flexible portfolio training initiatives, we're hoping will help those that are interested in research and academia to undertake opportunities to complement that. We're also looking at improving and producing a more equitable model for distributing training places. And we're hoping that by having less than full-time opportunities, this may address some of those gaps. And we also want to support aspirations of dentists in training. Now, this work also ties in with wider work within medicine, and that's the work of enhancing junior doctors' working lives. And that's all about work-life balance, well-being, and reducing burnout. So in terms of contributing to this work, now we thank all of those that have been involved in, the workshops, the communication, the survey, in animation videos, and we understand that there are trainees and educators that will want to continue being involved and providing feedback. So we're hoping to evaluate the rollouts of these options over the next 6 to 12 months. So please keep an eye out for surveys, and there will be plenty of opportunities for you to feedback on your experience. As I mentioned before, we have this centralised resource webpage which is exclusively for dentists in training, so please visit and share widely amongst your colleagues. Thank you. I will now pass over to Helen, who is going to speak about the trainees' experience.
Thank you very much, Sophia. Good evening, everyone, and thank you, Sophia, for inviting me to come and give a trainee's perspective of working flexibly within dental training. I must apologise for a couple of IT hiccups. My camera doesn't appear to be working, and Christina is very kindly going to move through my slides for me. I'm Helen Sanders, and I'm currently in my post-CCST role in paediatric dentistry in the Midlands, and I'm currently working as a 0.8 less than full-time trainee or 0.8 whole-time equivalent, depending on what terminology you want to use. For me personally, working flexibly in this context means that I've had the option to work as a less than full-time trainee whilst in my training post. Next slide, please, Christina. So, for the next 10 minutes or so, I'm going to give you my perspective of being a less than full-time trainee, both in my pre-CCST and my post-CCST roles. I'm going to briefly explain my route through postgraduate dental training and look at what the advantages and disadvantages of flexible training have been for me, and then reflect a little bit on whether this option has worked for me personally. Next slide. So my journey through postgraduate dental training has been a rather unusual and a slightly unorthodox one. And interestingly, it spans across several changes that have occurred in recent years for flexible trainees, which have made flexible working a much more attractive option within the dental training pathway. I was originally a registrar in paediatric dentistry well over 10 years ago, but due to a very serious illness at the time, despite having the option then to return to work as a flexible trainee after my treatment, I had to make the decision to step off the training pathway. At that particular time, the current option of being out of programme was simply not available or as well developed. The current supported return to training had also not really been developed or thought of as a concept. And so this meant that for a variety of reasons, I had to make at the time a very difficult decision to step off a training pathway and accept that perhaps I might never resume that particular career path. Now, I'm pleased to say, if you fast forward quite a few years, having had my two daughters and carried out my MSc in paediatric dentistry whilst in the community dental service, I decided to try and go back into training and finish what I'd started all those years. Work flexibly in order to in order to cope with the demands of having two school-age children alongside a considerable daily commute and the demands of a training post. So going through national recruitment, I was very fortunate to get my pre-CCST post of choice, which meant that from a geographical perspective, we didn't have to move the family. The post at the time was advertised as a 0.6 whole-time equivalent, and that would give me the work-life balance that I was looking for. This was actually slightly ahead of its time because you usually apply to a full-time training post and then apply for less than full-time once you're appointed in. And as Sophia has alluded to, there is actually a current less than full-time paediatric dentistry pilot in existence, which does exactly this, and it advertises training posts at point step of having to ask to become a flexible trainee. So having successfully completed my specialist training, I on my post CCST training post, and again I needed to be able to work as a flexible trainee in order to continue to juggle being both mum and a trainee. Again, I was very fortunate to get the post that I needed geographically because I wasn't in a to again move a family. In my current role, I then chose to work as a 0.8 whole-time equivalent because my daughters were getting older and my time was needed in very different ways. I'm also looking again to increase that percentage of whole-time equivalents, even maybe to full-time soon, because both my girls are heading towards senior school. And again, that ever so important work-life balance and the need to juggle childcare within our family is changing and altering. And as you can see from my little map on the slide, I'm nearly there. I've got one more exam to go. So it's been an interesting journey as a flexible trainee. Next slide, please, Christina. So I'm just going to briefly look at what I feel the advantages and the disadvantages of me having a flexible training post, a less than full-time training post, has been for me, and then consider a little bit how it's benefited me personally. So the advantages are really fairly easy and the ones that you would sort of think of. I've been able to return to a training pathway and still have non-working days where I've been at home for my family for some of the week. Obviously, that's meant I've been able to attend some of the school trips and the events, and working it part-time has also made it much easier to cover school holidays for us as a family. The training, however, does take longer. Protected post for a longer period of time, and I think some people will definitely find that that will help increase with clinical confidence and increase exposure to different clinical situations before ultimately you have to go it alone. However, there are definitely some disadvantages to being a less than full-time trainee, and again Sophia alluded to these in her introduction. The training pathway, yes, it takes longer, and obviously the pay is proportionately less. Although you might be at work less than 5 days a week, it can often feel as if the demands of the post still need you to work on your non-working days. The requirements of keeping up a logbook and a portfolio, etc., are the same regardless of how many days you work. And depending on the ratio of study sessions and clinical sessions within a timetable, there is almost a degree of inevitability that you will find yourself carrying out this type of work along with other projects that are expected on your non-working days. My daughters have always been at school on my non-working days, so I have been able to carry on with whatever additional work was needed regardless. But I have to say that if they'd been much younger, or for example preschool, whilst I'd been in that pre-CCST role, I think personally I would have found it very challenging to complete everything that was needed. Next slide, please. So is it working for me? Well, on a personal level, yes, absolutely. The less than full-time flexible training option has definitely allowed me to have that work-life balance that I needed so that I felt I could do my mum role and my training role equally, and it's definitely worked for us as a family. On a professional level, I haven't really found any direct obstacles to working flexibly. I feel it's definitely sometimes a little bit harder to get the timetable that you need in order to meet your training requirements, but I found that this can usually be sorted by having a really clear line of communication with your TPD and your educational supervisor. For me, I found it definitely helps if you're in a training programme that's already used to dealing with meeting the training requirements of a flexible trainee. Who, for example, might not always be able to work on certain days of the week, for example, and might risk accessing certain clinics, etc. Interestingly, COVID helped massively with my training because it caused such a huge shift nationally towards virtual meetings and virtual training. Working as a flexible trainee before COVID did mean that I couldn't always attend certain departmental meetings or access certain training days, as I didn't always have the ability to arrange the necessary childcare easily for something that was effectively on a non-working day. But with the move towards virtual training, being able to access meetings virtually just has made it so much easier to fit things in where previously it would have been almost impossible for me personally. I've not really found any barriers to accessing any of the opportunities, the wider opportunities that are available to trainees. And for example, I'm currently secretary to the local BSPD branch. I've been able to be a national trainee representative. I've been able to participate in regional MCNs and in clinical excellence networks within paediatric dentistry, and do all the usual posters and presentations that are part of any training pathway. Being honest, though, I have needed to do quite a lot of that on my non-working days. And I think for me, knowing that I would have to make that compromise was always part of my journey as a flexible trainee. I think training flexibly within dentistry definitely seems to be working as part of the NHS structure. I think people are realising the need for trainees to balance different aspects of their lives and still be able to progress within a training pathway. I think there's now a much wider willingness and awareness to encourage people along a training pathway at different stages of their lives and access different opportunities. And I think, as Sophia has demonstrated, there's a lot of work to be done, and it's definitely heading in the right direction. Excuse me. Next slide, please. So what would be my top tips for training flexibly within dentistry? Well, firstly, try and be really flexible. I think if you can try and get to things, if possible, on your non-working day, if it's needed to help with part of your training, see if you can adjust your hours, swap your sessions, alternate with colleagues, try and be inflexible as possible and make it work for you. That will help get you what you need. Think about why you want to work flexibly. Is it the work-life balance? Is it access to non-clinical opportunities? Think about how you need it to balance with the different parts of your life. And most importantly, I think be really prepared to communicate with everyone involved with your training so that you don't feel as if you're missing out on any aspect of teaching or clinical training that's available. And then finally, definitely use all the available resources. There are so many more available now than there used to be. And for whatever your reasons are for working flexibly, there'll always be something or somebody out there that will help you along that path. Next slide, please. So I would just like to say thank you very much for listening to my perspective as a flexible trainee. I absolutely have to say thank you to my family pictured here, because I think you'll find behind just about every flexible trainee there is often a hugely supportive and understanding family who help make it all happen. And thank you again for listening. I'll hand over to Sophia. Thank you.
Thank you, Helen. That was fantastic. It was really nice to sort of hear your journey and some of the sort of challenges that you mentioned that are not obvious initially, but obviously there's, when you look at any sort of decision that you're making, it's really important to balance, any of the advantages and possible disadvantages. But it seems that the route that you've taken has really enabled you to propel in your area of training. So thank you. And we'll hand over to Richard now, who's going to talk about his experience as an educator. Thank you.
Thank you very much, Sophia. Now, I'm assuming you can see my screen here. It's very kind of you to ask me to speak today about something which I feel very passionate about and which I've had quite a big learning curve, actually. So I remember several years ago, probably about, I don't know, must have been, it was before COVID, which always seems like years and years ago, probably about 2017, that I went to a full day-long course on flexible training. And when I went to it, I was kind of thinking, well, you know, flexible training, that's just about part-time, isn't it? How can we spend a whole day talking about this? And I was presented with this slide as an initial slide, and it was then that I started to get the inkling and that actually this idea of flexible training may actually be a lot more complicated. As Shafia has said, it really is a very hot topic at the moment. It's a topic that is of the moment in terms of dental training. HE's Advancing Dental Care Review just came out a couple of years ago, and if you have a look, you can see that flexible is mentioned 27 times, at least in the report. Indeed, if you go to the content section, then what you can see is that actually once we get through all the different blurb here, the very first section is actually talks about flexibility in training and careers. So clearly something that is very much top of the agenda at the moment. When I sat down to have a look at this, I sort of mind mapped it out, and I guess the thing that came through to me from this is not just the fact that, as always, when I put something on a slide like this, how bad my handwriting is, but also how complex the concept of flexibility is. And then actually, in terms of doing this exercise and preparing this talk for this evening, it was a real challenge to me to sort of distill this out into something which can actually be presented in a very structured kind of way. So I think a good starting point here is to really think about what we mean by flexible training, and what I'm trying to do here is put a very strong educator's view on this. This may be a slide you're familiar with, but if it's not, I'll explain it a little bit more. So basically, this is a building which represents a career path for trainees. And trainees are aiming to get from the bottom all the way to the top, and they're waiting here for the helicopter to take them off and to dump them into the workplace. And this is like a paternoster which goes up, and trainees will come in, they'll get on that paternoster, and they'll start their journey all the way to the top of their career. And at various points in their journey, flexibility allows them to get off this paternoster and to have a look and do different things. Look at the view, see what's going on, and then at some point when they're ready, they may go back on that paternoster and carry on their journey. Some trainees will take the slow route and actually will take the stairs, and they'll take they may take a little bit of time to get to the top. Other trainees will look neither left nor right and get the express lift and zip straight to the top there. But all of these are areas and paths which we should be prepared to try and accommodate as educators. So what do we mean by flexible training? Let's carry on with that theme. And as I was trying to separate this out, I came up with this number of different aspects. So we can look at less than full-time training, which Helen has spoken about quite really nicely earlier. We can look at flexibility out of training, flexibility within training, flexibility of trainee involvement in training, and that's something that I'm very keen on. I'll expand more later, and flexibility and access to training. So I'll talk about each of those and talk about my views. Obviously, less than full-time training is your classic flexible training. If you go back and look at the Gold Guide, if you go back to 2016, 2015, 2014, then this is really their definition of flexible training. What I would say about that from an educator's point of view is that in many ways, it has become a lot easier for us in that we as educators and as an organisation are far more sympathetic than we were, say, 10 years ago. So 10 years ago, if you look back at the Gold Guides, there was very much if a trainee requests for less than full-time or part-time working, as they had it at the time, there was very much a debate to be had, a consideration, an onus on the trainee to demonstrate why they wanted to go part-time. Now, we are far more sympathetic, and I would say that actually we are in a position where every request is really granted. I cannot remember the last time when we declined a request for less than full time. There's still a stipulation that trainees should train at least 50%, and that's still in there. And you could argue one way or the other. I think that's quite good. But actually, we, in terms of less than full-time working, in terms of part-time working, we are very, very sympathetic to that. What about the idea of flexibility out of training? And Shafira has touched on this in terms of her nice comprehensive list of the OOP, out of programme experiences. Well, out of programme for research and career breaks is something that's been around for a long time, and obviously, especially with research, this is something which is very, very well established, and we have a lot of trainees on this. And we have a number of trainees on career breaks. But I think the big change for me as an educator has been the fellows over the past, say, maybe 6, 7, 8 years. As many of you know, a leadership fellow is a dedicated 1-year out of programme experience for a trainee. And these trainees will do a postgraduate certificate, they'll develop their leadership skills. But the main thing I think for these leadership fellows is that they will hang their time off a particular project. And these are some of the projects that I've been involved in supervising over the last few years. From an educator point of view, this is something that makes my life much more satisfying. I really enjoy having these leadership fellows, and the projects are really excellent. They're not only, they change organizations, they help patients, and also they're really good for the trainees that do them. So if you look at, for instance, care pathways for children with congenital heart disease, so our leadership fellow Sophie, who did this, put a lot of work in revising those pathways in the Yorkshire and the Humber. But of course, she's now a consultant with a really invested interest in children with congenital heart disease, and it's considered to be one of our leading lights in that subject. Similarly, for one of my trainees called Lucy, who looked after children, and similarly with another of my trainees, Fiona, who's now consultant in Edinburgh, who looked at these pathways for amelogenesis imperfecta. So this flexibility in training, this opportunity, is giving people interests and skills that they're going to take well, not just into consultant, but beyond the consultant level as well. Of course, for any trainee that is out of programme, whether that's for a career break or experience or for research, or whether that's because of sickness or because of maternity leave, it's been recognised that there is a need to support them when they come back into training, and especially in the sphere of re-engaging with clinical work. And we're very fortunate that we have a very formalised organisation that cuts across the whole of England, which enables us to do that in a very structured way. So we've looked at flexibility out of training, and we've also got to think about, what about flexibility within training itself? Well, I think there's two broad areas here that we can look at. So there's lots of programs, and again, Shafia mentioned some of these. There are programs that are actually set up that trainees can actually apply to, which are flexible in their nature. So the obvious traditional one is a longitudinal training, and many of you will be familiar and have gone through that. Ghazala, who is who looks after our DCT program, is piloting our DCT 1-2 run through and DCT 2-3, and of course we have long-term NIHR collaboration for academic posts. So we have these programs that you can apply to, but the other really important concept within flexibility, and really ties into this idea of individualized programs, is the idea of opportunities within programs. And again, Shafir mentioned the flexible portfolio, which we just started piloting here in Yorkshire and Humber. But if you also look at, say, our foundation trainees, then Jason Atkinson, who looks after those, is really keen on stepping outside the sort of traditional structures of the foundation trainee in practice only. And the foundation trainees in Yorkshire and Humber get the opportunity to involve in a whole series of community engagement projects dealing with people who are homeless, refugees, school-based teaching, etc., etc., and something we've really tried to embrace here. This is a really important concept, actually, about trainees' input into training. It's a philosophy that we're trying to push forward more and more in Yorkshire and Humber. So, of course, trainees, we have trainee forums and we have trainee reps. And those trainees will come to us at those various different forums and committees and represent the trainees' views. And what we're trying to do is to actually take that a little bit of a step further. So at the moment, all our leadership fellows and all our reps sit on our senior management team. So often I'll look at the senior management team and think, goodness me, we're really outnumbered here by all the trainees that are on this. But the idea here is to make these trainees part of our decision-making process, to really look at them and say, look, these people can take on responsibility and process ideas and thoughts, and we can actually give them that responsibility to take forward. And we have trainees who sit on our on when we make appointments, and who also sit on our quality and our quality improvement. We've looked at flexibility in lots and lots of ways, and this webinar is about improving flexibility. And I have to say, I think that one of the big areas in which we can still improve flexibility is in access to training. At the moment, so if you look, for instance, at the traditional person who gets into specialist training, they will be somebody who's gone straight into foundation training. They've done DCT1, DCT2, maybe DCT3, and then they get into specialty training. The average age of a person entering specialist training this year is 29. So, so that is our traditional straightforward approach. But of course, what we do have is we have a workforce out there. We have, for instance, SAS grade oral surgeons, we have community dentists who are very, very good, who have got the huge potential to be excellent specialists, but for various reasons cannot enter training. Several months ago, we conducted a focus group with a number of SAS and community dental officer grades, really to look at the barriers for them entering training. And the barriers were mostly the ones that we would kind of anticipate, but there was quite an interesting spin on it. So clearly, one of the main barriers was that the clinicians were established in places where they were with young families, and they were concerned about moving those families and having to enter training and geographically moving. And geographical movement came up several times, and there was a real perception that, especially with national recruitment, that there was less control over where trainees would eventually be moved to, and it was a risk that a lot of them just didn't feel they could take, and quite rightly. Another one, I think for me at this stage of my life with a young family, I think job security is very important. So this is the concept that, look, if I'm going to go into specialist training, I have to give up a permanent job, a permanent wage and salary, and go into a training post which may be paid less, and which after 3 years or 5 years will end, and then I won't be, then what about my job security then? And then again, that kind of ties into the geography. Again, this concept about not being able to move. And this came up a few times as well, and I think this is really interesting. And so I don't feel I could do a full-time training post, and I don't think the options are as widely available for part-time as full-time. Well, we've just talked about how sympathetic we are to people going part-time. So clearly we're not really getting that message across. Actually, you know, we have recently, last year, advertised 2 pure part-time posts, but we should be trying to get the message across to people that actually flexibility and training, that they were to come along, and that is a perfectly, excuse me, acceptable way to train. Some successes. So for national recruitment, so James and myself took this to Central and Cobden recently, and national recruitment this year was the first time in which special circumstances were considered for specialist training. And so this was evening the playing field a bit. This was allowing people more scope to stay in their geographical area if they were entering training schemes. And this is hot off the press. We've just sent this to the Dental Education Reform Programme. And this is a big paper we did on the back of the focus group, which talked about upskilling to specialist level in dentistry. So this is suggesting a mechanism or a structure by which maybe we could look at people who are currently in post, upskilling within their post, within their job. And I think, you know, this is something I feel very, very passionate about. I think it's something that we really need to watch this space and see if we can try to push this through. I've waxed lyrical about flexibility, and I do feel very strongly about it, but I think it's really important to understand that there are challenges to this as well. Obviously, clearly, we're going to increase length of training, and that we're going to do that, and that means that we will have less people exiting at the end of it. Now, I think there is a strong argument which says that by flexibly training, what you do is you reduce burnout. You reduce burnout both at trainee level and consultant level, and therefore the size of the workforce stays about the same. But it's something we just need to consider. We need to make sure that trainees have equitable access to flexible training. And I'm not sure that that is the case at the moment. There is a little bit of a geographical lottery, I suppose, about trainees and what sorts of opportunities they may be able to access. Provision of service is important, and you know, trainees are there to train, but trainees are incredibly valued in providing care to patients. You know, that is the day job, and we really shouldn't lose sight of that. And so, you know, for every trainee that does go part-time or does go into a year out, and I completely support it, we're losing that care for those patients, or we have the potential to. So, you know, we have to think about that and get around that. Resource is a challenge. So we're just putting in another bid for a leadership fellow, and previously all the leadership fellow bids that we've put have been 100% funded, and it's this year for the first time they are only exclusively 50% funded. So I'm having to go to the trust for this leadership fellow and say, look, the project we're doing will be really good for you. Are you prepared to 50% fund it? So, you know, resources is always an issue, and you know, is going to be an issue. There is no doubt that flexibility makes my life more complex. It makes my life far more interesting. I really enjoy it, but it makes it more complex because I'm sitting there with 70 trainees, specialist trainees, and some of them are on OOPS and some of them are part-time and some of them are off for different reasons. Some of them are doing flexible portfolios, and you're trying to balance all these, and you've got to try and think about CCST dates and all of these different things. So it's, you know, it is a more complicated system to manage. And finally, I think we mustn't forget about governance and quality assurance of these programs. You know, as a deanery, we are accountable. We're accountable, we are going to become really accountable to the NHSE because we are losing a lot of autonomy in our merging with them. We are accountable to our dental training providers. So just like I said, if I'm going to Leeds Teaching Hospital Trust, which is where I'm based, and I'm saying to them, this trainee is coming out, their first question is, how are we going to backfill this activity? How are we going to manage? So we've got to be able to negotiate with them. We're kind of accountable to the colleges, or we're accountable to the colleges through you, in that there are exams that the trainees need to pass, and we need to provide the training and the foundations for them to pass those trainees. And we need to be able, we are also accountable for the SACs, which are a college body as well, which are going to look at the way we conduct our ARCPs, etc. And finally, of course, and talking about the day job, ultimately, we need to make sure that that trainees are the finished article, that when they come through the GDC, that when we recommend trainees to the GDC to go on the specialist list, that they have ticked all those boxes, that they are prepared to provide that care for those patients at that level. So finally, just in conclusion, just 3 little points to make. Okay, first of all, flexibility in training is good. I'm absolutely passionate about it. I think it is really good and really important. Flexibility in training is complex. It makes life for educators more difficult, but it does make it more interesting. And finally, flexibility in training is here to stay. Whatever we think about it, whatever we feel about it, ultimately, it's absolutely here to stay, and we need to accommodate it. And that's and that, for me, is a good thing. So thank you very much. I'll stop sharing. I'll hand back to Shafia just now.
Yes, hello. Thank you, Richard, for sharing your insights. It's really useful to reflect on how our approach towards flexibility in the profession has evolved over the last sort of 10 to 15 years. And you mentioned some of the complexities that arise naturally when we're trying to facilitate trainees being able to utilize these options. It's also really nice to hear that you're clearly championing these initiatives for your trainees, and your passion and enthusiasm really comes across. So thank you for that. Yeah, and the 3 take-home messages are great, for all of us involved with education. So thank you. Yeah, so that's it today for our webinar. For anyone that's watching, and like we said, this will be available for you to rewatch if you need to, and for any trainees that weren't able to make the webinar today, it will be uploaded to our dental webpage. So if you need to access any of the resources, we also have 2 videos that explore some of the options that are available to you now. Please check out the webpage. Thank you.